Welcome to Olympian Water Testing, giving you the best in water analysis. Today we are looking at NYC Health, and we're taking a look at mercury, how it affects fish and shellfish, metallic mercury, and mercury compounds. So this is actually naturally occurring in rock, soil, and water and living things. It's also been historically used in some consumer products, but the longer and more often you're exposed to mercury, the greater the health risk is. So first, fish and shellfish, what happens with that? So mercury can deposit in lakes, rivers, and oceans and build up in the fish we eat. Larger fish and fish that eat other fish have higher concentrations of mercury in their tissue, and fish can be part of a healthy diet, but most people can eat fish without being concerned about exposure to mercury. But there's a catch to this. Younger children and fetuses who are exposed to high levels of mercury are at risk of developing learning problems, and pregnant and breastfeeding women under the age of 6 should choose fish low in mercury and limit their portion sizes. Now, how do you actually do that? Well, the bigger fish, the more amount of mercury. That's because mercury gets into the water, and then it mixes with bacteria. Now, it gets into the water either naturally or through industrial or agricultural actions. Once it gets into the water, it mixes with the bacteria, and then once it mixes with the bacteria, then smaller fish will eat it, other fish will eat those fish, then those fish will eat those fish, and then bigger fish accumulate more. It all starts with getting infected in the plankton and then fish eating those. So for that reason, to limit mercury, it's a good idea for people who are pregnant or breastfeeding women or children under 6 should choose fish that are lower in mercury. There's also metallic mercury. Now, this used to be common in household products and manufacturing, and it's used to decrease in response to laws prohibiting or limiting mercury, and mercury may still be found in some products, especially older items made outside the United States. Metallic mercury is in older thermometers, blood pressure cuffs, fluorescent light bulbs, and electrical switches, and when byproducts are broken or spilled, when engaging in practices that use metallic mercury for cultural or religious purposes, metallic mercury can be a vapor, and breathing in low levels of mercury over a long period of time or exposure to high levels of mercury vapors can cause coughing, chest pain, trouble breathing, skin rashes, memory loss, moodiness, and shaking. And we also have mercury compounds, and that's certain dietary supplements, lighting, skin creams, and soaps that contain mercury, and people are exposed to mercury in these products if they swallow or apply them to the skin. And mercury in this form can cause memory problems, skin rash, and damage to the nervous system and kidneys. And you can avoid using items that contain mercury. Do not use creams, soaps, dietary supplements with mercury. Pregnant and breastfeeding women and young children should choose fish wisely and eat fewer or smaller portions. Appropriate dispose of mercury of containing products such as older thermometers, burned out fluorescent light bulbs, creams, and dietary supplements that contain mercury, and do not throw these products in the trash. Seal the product in a plastic bag or plastic container until they can be properly disposed of at the New York City Department of Sanitation, and keep those products out of the reach of children. So that is the basics of mercury, the different kinds, and the different things to watch out for fish, shellfish, metallic mercury, and mercury compounds. With that being said, mercury is definitely a dangerous neurotoxin. With all this, we know that it's getting into our water, particularly how it's affecting fish and shellfish. That's why it's always a good idea to periodically test your water for any level of mercury.